Hi. Hi, everybody, and welcome to our webinar, November webinar, Feeding the Broodmare. So the goal with any breeding operation is really to produce sound quality foals that are improving the genetics of both the mare and the stallion. We're going to focus on the mare tonight. Other webinars, we've talked about stallions and foals, but tonight we're going to talk about the mare. I think the first place to start is realizing that reproduction is not a given, but it's a bonus. It only occurs when the mare has adequate nutrition and body reserves. And the mare will not become reproductively active until she has all of those things in line. She's got correct nutrition, she's getting correct hormonal signals, i.e., it's the correct time of the season. Um, it's centered around many things, but they include nutrition, as we've said, day length, or more really daylight, temperature, an increase in nutrients. All of these signal that reproduction is possible. And if the mare has the correct body condition, she'll cycle. If she is too fat or too thin, these will both interfere with her reproductive cycle. So what is ideal? Ideal is a 5 or a 6, whether it be a performance horse or a riding horse or even a mare that we're getting pregnant. Ideal on a scale of 1 to 9 is sits right there in the middle. We will get cycle earlier in the year, decreased services per pregnancy, and increased number of pregnancies. When you palpate this horse, you don't really have to dig really hard to feel the ribs, but they are there. Too thin is anywhere from a 1 to a 4. You'll notice longer interovulatory periods. If they cycle at all, you'll notice that the time between cycles is much longer. Decreased ovarian activity, so they're not going to be producing follicles. Decreased conception rates. Even if you do get them pregnant, it's really hard to maintain the pregnancy. And if they're maintaining or losing weight, this is a problem. Now, what might be acceptable is if we have a mare, say, at a body condition score of 4 and she's actively gaining weight, that may be more successful than if she is a 5 and she's actively losing weight. A fat horse is anything that is 7 to 9. More often, we're going to see 7 or 8, but a 9 is possible. And remember that fat acts like a hormone, acts like it signals hormones and can secrete a lot of hormones. And those hormones can interfere with the hormones that are required for reproduction. So we don't want a horse to be too thin or too fat. Too fat, well, as I mentioned, hormonal imbalances, impaired cycles, poor rebreeding, not to mention dystocia when they're having the foal if you actually maintain it that long. Laminitis, impaired egg quality or oocyte quality. So we need the semen and the egg, and if we have really poor oocyte quality, then that's going to be a problem. Reduced fetal growth. So we get her pregnant and then we have an issue with fetal growth, and then that fetus is also predisposed to disease. In horses, we know that obese mares potentially predispose their foals to developmental orthopedic disease. So in pregnancy, we're looking at early gestation, which is less than 6 months. It has a similar requirements to maintenance. We know that minerals are crucial for early development and early embryonic development. And this is a time where we can increase body condition if needed. Light exercise if they're too fat. Don't overfeed them. But we all know that in the pregnancy, in the first 30 days is absolutely critical. We can see the heartbeat then. So critical organs are developed very early on. When I'm giving this presentation in a room, I'll always ask people kind of the most important time to feed a pregnant mare. Is it before she's pregnant? Is it once you first get her pregnant? First trimester, second trimester, third trimester? And most people will put their hand up and say third trimester because we have so much tissue and fat being laid down at that point. However, that isn't the most important time. For me, the most important time is before she ever goes into the breeding shed. We need to get her in the correct frame to actually accept being pregnant before we even go down that path. So Mid-gestation is 7 to 8. We do see an increase in energy and protein requirements and an increase in calcium and phosphorus requirements. The source of calcium can be really critical at this point. You know, we are using calcite in the colt grower, and that can be very important to developing adequate bone density. Chelated minerals versus inorganic or sulfated trace minerals. Those chelated minerals are really good. They're much higher bioavailability. We've seen in research that they have much higher retention time in the mare and do transfer across the placental barrier. We know that the combination of chelated minerals and mannan oligosaccharide, or MOS, which we also have in our products, also increases the immune function of that foal once it's born. It can pass across the placental barrier and improve immune function. So when we look at the first trimester of pregnancy, we're looking from 1 to 4, 5, 6 months. We see that the protein and energy requirements really stay very level. They don't really increase. But by the 6th month onward, on through 11 months, we see this increase in protein and energy requirements. In the pregnant mare, and we're not going to focus too much on the pregnant mare because we're really worried about getting the mare pregnant, but I've just point out a few things. That exercise in mares, as it is in people, is actually very important and can be very beneficial to pregnant mares. It can increase cardiovascular function in the fetus. It can increase blood carrying capacity. It's going to pump more oxygen around. Research has shown in pregnant women that they exercised moderately, increase fetal lung development, decrease fetal heart rate, less stress on that fetus. So oftentimes it's forced exercise. It can be just to control body weight, but it improves fetal development, enhances cardiovascular function in both the mare and fetus. And it doesn't have to be excessive. Maybe it's just some light lunging. Maybe it's light riding if they were used to that. And it's not that we're going to go from a horse doing no exercise to in the 3rd trimester, now we're going to actively exercise her. Just like people, you have to have been exercising all the way through. So if you feel like this is something that you want to do with your mares, then you should start your exercise program before you get them pregnant, get them in good body condition score, and throughout pregnancy, maintain that exercise level. Non-pregnant mares, when we're talking about metabolic syndrome and having them too fat, and that's interfering with their glucose and insulin, we know that that can really affect their ovarian function. We know that impaired glucose function, glucose is really important for the maturation and ovulation of the dominant follicle and the formation and maintenance of the corpus luteum. And if glucose is not entering the cell, as is the case with the horse with insulin resistance, where the glucose is just floating around in the blood because it's not being driven into the cell by insulin, then that can be a real problem. We're not going to see adequate maturation of those dominant follicles or maintenance of the CL. Insulin can also affect follicular development. It can act like other hormones. Insulin insufficiency or not enough insulin has been observed in cystic ovarian disease in cattle, and also polycystic ovarian syndrome, which we call it PCOS, and we see that a lot in women, and that can be associated with insulin resistance. And that in women doesn't always mean that that woman is overweight. Sometimes it can be underweight as well. So these are all things that we need to make sure that glucose and insulin are functioning correctly. And we do have products to make sure that that is occurring. Insulin resistance or present signs of equine metabolic syndrome, whether they're obese, they have a crusty neck, weird fat pads. These mares tend to have a lot of small or medium follicles, but nothing ever really develops into a dominant follicle. And without a dominant follicle, we're not going to get rupture of that follicle and release of an egg, so that pregnancy is not possible. So making sure that we are not trying to breed mares with equine metabolic syndrome, that we're taking care of that prior to the breeding season is going to increase your chances of an adequate pregnancy. So now I want to dig a little deeper into reproduction in the mare, and some of this may be some repetition for some of you, it might be overkill, but I think just honing in on some of these normal features of mare reproduction kind of point us in the direction of the areas that we need to be focusing on when we're supplementing or we're managing those mares. So a mare is referred to as seasonally polyestrous, meaning that she's going to have multiple heat cycles throughout certain seasons. So seasonally, she's not breeding in the winter months, but during those summer and spring months, they're going to have many estrus cycles. There are some animals that do not have, they just have one single estrus cycle. So the mare will have heat cycles many times during that particular season. Mares typically begin to cycle in early spring and continues to cycle through early summer months. Now the goal in equine breeding is we have arbitrarily, it really comes from the thoroughbred industry, but we've arbitrarily decided that we want to have all these foals born as early in the year as we can. So we're trying to artificially manipulate when they are seasonally active. Now, the January 1st, unless you live in southern Florida, is cold and mares aren't cycling. So are there things that we can do to get them to come into heat earlier? It's well documented that cycling starts as a response to increased photoperiod and a change in light. Therefore, by altering the amount of light the mare is exposed to each day, horse owners have been able to extend the length of the breeding season or begin the breeding season earlier. And we will discuss that a little bit more about the use of lights or putting mares under lights to quicken the beginning of the breeding season. Now, the breeding season, being that it's seasonal and this seasonally polyestrous period, you know that horses will grow a hair coat and shed a hair coat also based on the season. And so the two are connected. What we have seen is when you alter that seasonality and we kind of force the mares into an early estrus, we also see that they will shed their hair coat because it's not like you're ever just affecting one thing. You're always affecting multiple aspects of the horse. So horses need at least 14.5 hours of total light to perceive longer days. The tried and true program is to provide artificial light so that the total light period, daylight and artificial, is 16 hours in length. Most people use automatic timers that will turn on 30 minutes before sundown and stay on for 5 to 6 hours to achieve the recommended 16 hours of total light and then 8 hours of dark. If sun rises at 7 a.m., lights need to go off at 11 p.m. The light source can be incandescent, fluorescent, or halogen, and the intensity of the light at the level of the mare's head should be 2 to 10-foot candles using a light meter. Now I've got some a particular study and a new way that people are actually applying this light to horses as well that I want to talk to you about. But 60 to 9, now we need to do this 60 to 90 days before mares would cycle normally. So that's right now, really, if we look at 2 to 3 months, if we're trying to force them to cycle early, it will take about 30 to 45 days for mares to make that transition. And an additional 20 to 30 days to go through a heat cycle. Beginning a lighting program in late November or early December should allow for a late February breeding. Most mares will most likely show behavioral signs of heat before this time, even though they do not actually go through an ovulatory cycle. So if they're having foals January 1 or close to, as we can get it, then we Most often we'll try to breed them on the fall heat. Mares will come back into heat pretty quickly after they have a foal, but there's also some supplements that we can use to decrease that window and increase our chance of getting her pregnant as quickly as we can after she's had that foal. Leaving the lights off for several days reduces the effect of the lighting program. And also the mares need to stay under lights until they are bred or the natural daylight is lengthened with the change in season. So we're going to do this. If we're trying to rebreed a mare, we're going to turn lights on while she's still pregnant. She hasn't had the foal if we're having foals in early January. There is some research to suggest that changing the lighting for mares also increased body weight and shortened actual gestation. So the lighting program does not stop too early in the breeding season. An added effect of the lighting program is that mares will start to shed their hair coat as well, which also, if we're in a really cold climate, may result in us needing to put blankets on them because the hair coat really does act as an insulator to the outside weather. Now, before we get into what supplements we can use and are fully able to understand lights, I think it's really important to understand the estrus cycle. And so a lot of people that breed horses have a pretty good idea about the full estrus cycle. But I figured for those of us that are trying to sell products to clients, it might be a good recap. So the estrus cycle time from the first day of heat until the first day is defined from the first day of heat until the first day of the next heat period. In an ideal world, this would be a 21-day cycle. The estrus portion, so we call it the estrus cycle, but within the whole estrus cycle, there are estrus portions. That's when the mare is actually receptive to the stallion. During this short estrus window, it's typically about 5 days. A follicle will rapidly develop in the ovary and will be released during the latter stages of estrus. Therefore, the time to breed in the estrus cycle is mid to late estrus. Diestrus is the portion of the estrus cycle, the whole estrus cycle, in which the mare is not in heat. Maybe that's where the corpus luteum is. And the anestrus period is the time of sexual rest. So that is the anestrus period is winter, cessation of all ovarian activity, and that is what we're trying to get ahead of, the anestrus period, and force them out of anestrus and back into their polyestrus period. So that anestrus is during late fall into the winter months, although location will sometimes affect the length of the anestrus period. And so you can see during the estrus phase, we have estrogen is produced, we have the follicular phase, the luteal phase, and the follicular phase is when those follicles are developing, and then we have them rupturing, and then from that rupture site, that becomes a corpus luteum, and that's going to produce progesterone, and ultimately it's supposed to then maintain a pregnancy, but if we don't get a pregnancy, then the CL will also regress. The estrus cycle is controlled by hormones. Hormones are chemical substances created by the body that control various bodily functions. So the pituitary gland is located at the base of the brain, and we've talked about the pituitary gland a lot when we talk about Cushing's disease, which is when we get a tumor on the pituitary gland, and it interferes with the hormonal signals that will tell the horse to shed its hair coat, right? That signals that we're coming out of that anestrus, that winter season, and coming into the estrus period. And so horses with Cushing's won't cycle either because we're interfering with that. They can't determine that we're going out of winter and into spring. But the pituitary gland, as I mentioned, located at the base of the brain, and produces follicle-stimulating hormone and luteinizing hormone, right? FSH or LH. As spring approaches, the pituitary gland is stimulated by the increase in daylight or the day length, and that enhances follicle-stimulating hormone production. Follicle-stimulating hormone is then released into the bloodstream and travels to the ovaries to initiate the development of follicles continuing to the ovum. The developing follicle produces estrogen, which is now released into the bloodstream. Estrogens have a number of functions in the body. When the blood estrogen reaches a certain level, a surge of luteinizing hormone is released from the pituitary gland into the bloodstream. Estrogens are responsible for the clinical signs of estrus. So when she's receptive to the stallion, that is because you could take a blood sample and you could see if she's not receptive to the stallion. Now, it might just be nervous. It might be a young mare who's not really sure of what's going on, or there might be something interfering with estrogen production. If she's very receptive, you'll notice high estrogen levels in the blood. And they act on the oviducts, the uterus, and the cervix to prepare the reproductive tract for pregnancy. So it'll change mucus levels in the uterus and the cervix. The surge of luteinizing hormone causes the follicle on the ovary to rupture. That's what we call ovulation. As the follicle develops on the ovary, the egg inside the follicle undergoes a number of changes to become capable of being fertilized by the sperm. The follicle contains, it's like a sticky, viscous liquid, and when the follicle wall ruptures, this fluid flows out, carrying the ovum with it. The cavity left by the ruptured follicle becomes engorged with blood, and it forms a corpus luteum, hemorrhagicum. And when you do an ultrasound and you're looking, it looks really black, like and then it'll go really white. So when you see a follicle, it's got a white kind of ring around it, and then the fluid inside is black. And then then that ruptures, and it'll slowly, as the corpus luteum develops, it'll get whiter and whiter. So at first it's this big black mass, and then it becomes whiter and whiter. The corpus hemorrhagicum luteinizes to form the corpus luteum, sometimes called the yellow body. So if you actually get an ovary and you can dissect it, the corpus luteum is yellow. As the corpus luteum develops, it starts to produce progesterone, which influences the pituitary gland. See, it all cycles back on itself, and the reproductive tract. Now, what we know is that obese mares, the obesity and the hormones secreted by fat when the animal is fat, and the fat is producing hormones, leptin being one of them, that interferes with the regression of a corpus luteum. So they hold on to their CL a lot longer than they should, even though they're not pregnant. So they kind of fake think they're pregnant. But anyway, the corpus luteum produces progesterone, which influences the pituitary gland and the reproductive tract. The feedback of progesterone via the bloodstream inhibits the release of luteinizing hormone, right? So we produce progesterone, and it stops secreting that luteinizing hormone. And under the influence of progesterone, the male will not show estrus, right? Progesterone its function is to maintain the pregnancy, and by maintaining a uterine environment conducive to fetal development. But if the mare does not conceive, the corpus luteum remains functional for about 12 to 14 days. Then we realize, okay, we're not pregnant. At this time, prostaglandin is released from the endometrium, from the lining of the uterus, because nothing has implanted. So we know, okay, not pregnant. We need to do this all again. Prostaglandin has a luteolytic effect, which means it acts on the corpus luteum via the bloodstream, causing it to regress, or it lyses the corpus luteum. As the corpus luteum regresses, progesterone levels go down, resulting in the removal of the inhibition of the luteinizing hormone secretion, and the cycle starts all over again. But in the fat mare, as I mentioned, it interferes with prostaglandin release, and we have a mare that sits in this phase thinking she's pregnant, keeping on producing progesterone, in the luteal phase gets extended. So instead of it being a 12 to 14-day window, maybe it's 14 to 18-day window. Now, if you're in the business of breeding mares, you need to get this done as quickly as possible. And if she doesn't conceive, you've got to get her turned around as quickly as you can. And if she's dragging it out for another 18 days, or you've got a mare at a breeding facility and they're charging you for every second she's at your farm and every meal she eats, this is becoming very costly. So if the mare conceives, hormonal activities are essentially the same as for the 12 to 14 days post-ovulation. Pregnancy recognition is stimulated by the action of the developing embryo. It's migrating throughout the uterus. It's bouncing around, and that action inhibits prostaglandin. So we said if there was nothing in there for 12 to 14 days because we didn't conceive, then prostaglandin gets released because the uterine lining is not recognizing any embryo, nothing's been bouncing around trying to implant. The result is that anti-luteolytic effect. So the corpus luteum remains functional when we're pregnant, and progesterone levels are maintained and the pregnancy is continued. Somewhere between days 25 and 30 of gestation, the corpus luteum starts to regress, resulting in a declining blood progesterone coming from the CL. But if the progesterone level to continue to decrease, the pregnancy would be terminated. However, a compensatory system has evolved that is unique to the mare. Between the 25th and 36th day of gestation, there's like this girdle-like band of special cells that develop around the fetal sac. So right now it's in this little sac, and there's this band that have all these special cells. And on about day 37 of gestation, that band detaches from the fetal membranes and invades the endometrial wall, where these cells undergo huge enlargement and structural cell change. They clump together to form endometrial cups that secrete the hormone equine chorionic gonadotropin. And when ECG, or equine chorionic gonadotropin, reaches the ovaries via the bloodstream, it stimulates secondary follicular development and luteinization. And then the secondary corpus luteum produces progesterone, as does the primary corpus luteum, to day 130 and 150 days of gestation. So that's why when we worry about early embryonic loss, a lot of times it's because of an interference with progesterone levels, and that's why we'll artificially give progesterone early in pregnancy to mares that continually lose early pregnancies, and that will help just assist the CL, assist that girdle-like sac until we can get it to produce enough progesterone. From about day 80 of pregnancy to term, adequate progesterone levels are maintained by the special areas of the uterus and the fetal membranes to sustain pregnancy. So these endometrial cups then are producing that progesterone. So you can see that it is really a very complex system, where really it all starts with the eye, sunlight, or the amount of daylight hours that is recognized through the eye. That goes to the hypothalamus. It actually goes through the pineal gland and through the hypothalamus. And then we recognize through the amount of melatonin that is produced. Melatonin goes down, and then GnRH goes up, and LH and FSH, and we have this cyclicity. So, that's why daylight and altering or manipulating daylight can be so effective, because it is really the stimulator for everything. So there's research looking at artificial photoperiod in pregnant mares and its effect on pregnancy length and postpartum reproductive performance. So 145 thoroughbred mares, ages between 4 and 23, they used a 15-hour light, 9-hour dark photoperiod day. And the groups that they had were less than 30 days of artificial photoperiod, 30 to 45 days of artificial photoperiod, 46 to 60 days of artificial light, or greater than 60 days of artificial light. And it was concluded that using the 15 hours of light, 9 hours of dark, that during the at least 60 days before delivery, using that for at least 60 days prior to delivery, decreases significantly the incidence of that anestrus time that we get postpartum. So we can start her cycling much quicker after she's had the fall. The use of this photoperiod for more than 30 days decreases kind of the time in which she'll start ovulating. Now, there is this a lot. What we've used in the past has always been using artificial lights, bringing them into stalls and utilizing artificial lights. Well, what if we don't want to keep them in stalls for health reasons, for soundness reasons, or we've got broodmares that we just don't have that. We've got 50 broodmares and we don't have 50 stalls that we're bringing them into and able to change the daylight, and it's much easier to manage them out in the pasture. Then there is a product called Equiloom, and I've been hearing a lot more about it. Also people are using this for show horses, and you can see that it's just a head stall that you put on, and it's actually only just in one side got an artificial light source that is directed right at the horse's light, and you put a timer on it, and it goes on and off, and it creates exact wavelength. Here's some of the research. So in 2012, a study was conducted in Kentucky. A lot of this came out of the University of Kentucky as well as Guelph up in Canada. And they had three groups, either no artificial light, the other group was standard stable lighting, or they used the Equiloom mask. Now, this was the original prototype. And what was interesting to them and what was a great outcome was that over 90% of the mares in group 1 and 2 were reproductively active by February to 10th. And there was no difference between those. So that meant that the mask, while we weren't keeping them in stalls, and we weren't altering temperature or actual like light, we were using this blue light Equiloom mask. We were able to mimic changing lighting as we would using the more stereotypical staple lighting. It also prevents prolonged gestation length. I thought this was interesting. So you're able to decrease gestation length by using the Equiloom mask. So no light average gestation was 350 days, but by using the Equiloom mask, you were able to get gestation down to 339 days. Now, does that sound like a lot? No, but when you're giving the uterus time to get back to normal, that is giving you extra days earlier in the season. Now that we're going to be 5-10 days earlier that we can breed that mare. So that was also very interesting. The other thing that is really important, because all of this changing daylight is great for the mare that is not currently pregnant. But if she's currently pregnant, we can utilize altering daylight and we can get her to have the baby earlier, and she might come back into estrus earlier. But we need to make sure that the uterus is gone back to normal. So we call that uterine involution. So this study looked at uterine involution of mares supplemented with dietary algae-derived omega-3 fatty acids during that peripartum, like after pregnancy. So what is uterine involution? Uterine involution is a physiological process by which the uterus turns to its pre-pregnancy dimensions with endometrial regression, reduced uterine blood flow, and endometrial vascularity, and reduced muscle mass. So we're going back to our pre-pregnancy, which means that they're going to be much more likely to get pregnant again. So normal uterine involution in the mare, placenta is past 3 hours postpartum. 2 days postpartum, we see a marked decrease in uterine size. Most of the uterine fluid is gone. 3 to 5 days postpartum, the uterine horns now are back to their correct shape and can be palpated. 5 to 15 days, so the onset of postpartum vol heat usually starts around day 7. Those micro caruncles that we saw through pregnancy that were attached to the endometrium, they're no longer evident. By day 14, the endometrium has a normal histological appearance. The uterus is no longer enlarged, but the cervix does not close until after fall heat. Fall heat ovulations, day 9, about 43% ovulation. 15 to 20, though, we're looking at 93 to 97% ovulation, and after day mere ovulation after day 10 usually results in a normal pregnancy rate. So we're really looking to see if we can speed that up or improve that process in some mares, because that was all pretty standard numbers. So there are mares where it takes longer, or they're older, they've had a lot of foals, and it's just harder to get that uterine involution so back to normal pre-pregnancy as quick as we would like it. So the objective of this study, which was just recently done, was to evaluate the effects of mare's dietary supplementation with algae, DHA. Where have you heard that? You've heard that in the DHA Perform or the Breeders Excel, and to see if they could influence follicular dynamics and uterine involution in the early postpartum mare. So 18 pregnant mares, no particular breed, were used. The mares were randomly assigned, whether they were on the control group or the supplemented group, and the treatments were supplied from 90 days prior to expected foaling date until 7 days after the first ovulation. Supplementation with DHA during that period benefited uterine involution, so it sped up uterine involution and increased the rate of earlier conception rates. So, in summary, what DAC products stand out when we're talking about managing and feeding the broodmare in particular? Well, the first thing that stands out to me is the DAC metabolic. Remember, it's got the chromium and the magnesium, and the chromium really can realign glucose and insulin and make them function more correctly. Remember at the very beginning I said if glucose and insulin are out of whack, if they're not functioning correctly, that's going to affect follicular development and oocyte quality. Mares with metabolic syndrome, obesity, insulin resistance, they develop lots of small follicles, but none of them ever developed into that one large dominant follicle that was going to ovulate. Also, the obese mares, that interfered with the lysing of the CL so that it would come back and we could start the follicular development again. I believe that the chromium might stop that from occurring. So the feeding chromium, as in the DAC metabolic, will help glucose and insulin work properly, and it may help us with those overweight mares that we haven't been able to get their body weight under control, to stop that longer period of the luteal phase. The DAC Breeder's Choice Plus, that's our vitamin and mineral supplement that we use during the breeding season that's going to maintain adequate chelated minerals, adequate selenium, organic selenium. All of these are going to improve reproductive success from the vitamin and mineral standpoint. Then the DAC DHA Perform, which is that algae-based DHA. We just saw that it can improve ovarian function, uterine involution, so we're going to get that uterus back to being in fighting form, ready to take on a pregnancy again faster, get them ready for rebreeding faster. And then we mentioned the lights, obviously the lighting protocols, 15 to 16 hours of daylight, followed by the 8 to 9 hours of dark. And the Equiloom mask being a viable alternative for putting horses in stalls. I have no connection to those masks, by the way. I just think they're cool. So with that, I'll take any questions.